Good morning. I'm with Marta Siepsiak from Department of Psychology, Faculty of Psychology in University of Warsaw, Poland. And Marta, thank you very much for joining me this morning.
Thank you.
Marta and her team has done a lot of research on misophonia in the past few years. You are very young yourself, but you have done so many studies. I have been following you for several years and enjoyed learning from your articles. And you have developed, you and your team, the questionnaire MisoQuest for misophonia, which now have been translated to several different languages, and other people are also using it to assess misophonia in their clinics. And I know that in the UK, a couple of studies have assessed MisoQuest validity, and they are now very close to publication. And so well done for all of your contributions to the field of misophonia, you and the other people who are in your department. So it's fantastic. And hopefully all of these will help to improve the life of people who experience misophonia. So I understand that you are presenting in the 6th International Conference of Hyperacusis and Misophonia at Birkbeck College, University of London. I think your presentation is planned for 1st of July. And in fact, is in the first session with myself. And so that's great to have you there. So tell us a little bit about your research that you want to discuss in the conference.
Okay, thank you for such a nice introduction. Good morning. I'll be talking about the study that we conducted. We wanted to check whether some temperamental traits and some psychiatric disorders are more specific for misophonia. And so we compared misophonia group, the controls, and people with auditory over-responsivities. With those traits, with some questionnaires of misophonia, temperamental traits, and psychopathology. And we wanted to check whether misophonia symptoms mediate between some temperamental traits related to neuroticism and psychopathology. Because people with misophonia experience very high stress every day. Those are very stressful situations for them, and it's known that psychopathology is the rate of psychopathology is high among misophonia sufferers. So we assume that maybe this is because some people are more prone to psychopathology because of neuroticism traits, and additionally with those stressful events, they are even more prone to develop it. So we checked it.
Oh, fantastic, because it is always very difficult to understand that from the research of other researchers, also from the research from yourselves. So we do understand that there is this comorbidity between misophonia and a lot of mood disorders and anxiety disorders, but it is usually hard to know, like, is it because this person is suffering from misophonia that they end up feeling isolated and depressed, or if a person has traits of depression, they are more vulnerable to develop misophonia. So you have done modeling. Is that some sort of a models to work this out? Like, what is the mediation factors and things?
Yeah, some simple model, mediation.
That's fascinating. Yeah, I really look forward to listen to your talk and learn about how these interactions between the symptoms of misophonia and anxiety and depression or other psychological or psychopathologies, as you say, relate to one another. Fantastic. Thank you very much, Marta. I know that you have a busy schedule, so I let you go, and hopefully see you in London on 1st of July.
Yeah, see you in London.
Thank you.